This segment is brought to you by the Southeastern Spine Institute.
Welcome to Southeastern Studios, where we learn about the latest medical technologies and sit down with physicians who are prominent in their field. All right, I'm back at Southeastern Spine today with Dr. Tim Bryan. How are you doing today?
Doing well, how are you?
Wonderful. Now, one of the benefits of Southeastern Spine is that you can get patients in and treated really quickly. How do you guys do that?
We have everything in-house in one building. So we have doctors that specialize in pain management, doctors that specialize in conservative care, rehabilitation, so non-operative type physicians, and we have surgeons, radiologists, all that kind of in one building where we can take care of everything. And the nice part about that is, since we've all got it in one location, we can get people in quickly. So I have patients that call up, come in sometimes same day, they're evaluated, they get an x-ray. If an MRI is indicated and they need an MRI, we get an MRI same day sometimes. We can see them right back up, get a plan together pretty quickly.
When you have a new patient come in, what are some of the goals that you have when looking at a treatment plan?
Yeah, so patients are usually coming in with pain or weakness or numbness, so it's pretty disturbing to the patients. So they want to get an answer pretty quickly, mainly because they're hurting. So oftentimes we're evaluating them. Oftentimes that does require the use of an MRI to get a close look at the back or the neck and get a fine resolution detail where we can look closely and see what the problem is and then develop a treatment plan. And sometimes that's without surgery, sometimes it is. You know, and I understand patients are scared, they're nervous, but I think they're also concerned when they have such bad pain and weakness. You know, that's something that you shouldn't put off. You want to, even though it might be a little bit concerning at times, you want to get an answer to it, figure out what's going on so we can address it, fix it.
Definitely. What do you think you've been able to learn from the other people working on your team?
Yeah, we do collaborate a lot. We help each other out, so we work together daily in and out. So it's nice, you know, we're always keeping up to date with newer technology, so we kind of push each other to go to courses and, you know, investigate new technologies that are coming out. We host laboratories or visiting, traveling courses where they come into our office and use our labs and use our operating rooms to review new technologies so we can see it firsthand. So we do that pretty regularly. So that's one thing with us all in one roof, you know, all working together, we're staying up to date on the newer technologies that become available, such as robotics and image guidance and navigation and, you know, cutting edge technologies.
Let's talk a little bit more about robotics. This is a big thing that you use daily.
Yeah, robotics are I think, the wave of the future. So it's nice for multiple reasons. It syncs nicely with minimally invasive treatment options, so smaller incisions, less blood loss, which translates into less post-operative pain and quicker return to activity and shorter recovery.
Now, I've asked you this question before, but I want to ask it again. What is the most rewarding part of your job?
I think the most rewarding part is seeing patients coming in that can't stand and walk because they have a terrible back or leg problem or neck problem and they can't use their arm and they're miserable. You know, I've had patients that crawl in, you know, on the floor because they can't stand up and walk and, you know, take them to surgery and then, you know, the next day they're walking out and walking home. So it's that's I think the most rewarding part is taking people that are in pretty bad situation and, you know, in some cases making a dramatic improvement in the span of a day or two.
Thank you for joining us for another segment from Southeastern Studios. And as always, you can go to southeasternspine.com for more information.